We are pleased to welcome Congresswoman Andrea Salinas, who is from Oregon. She serves as co-chair of the Bipartisan Congressional Mental Health Caucus, focusing her efforts on strengthening our nation's mental health services and supports. She has supported bipartisan bills such as the Reentry Act and the NACo-backed Michelle Alisa Go Act to improve access to care in communities nationwide. Please join me in welcoming Congresswoman Andrea Salinas.
Well, good morning, and thank you for having me, and thank you for that kind introduction. I know we have people here from all over the country, and I'd like to give a special shout out to our Oregon counties. I think I heard them somewhere over here, yeah. I can attest that it is a long way to travel to be here. And I know you just heard from my colleague, my chairman, Representative Thompson, chair of the House Agriculture Committee, who I must thank for my attendance today. We had intended to hold a markup later on today on the Farm Bill reauthorization, which required me to fly out yesterday because I wouldn't have gotten here in time for today's markup. But snow, weather, things get canceled here, and we adjust. So it's been postponed, but despite the scheduling changes, I could not be happier to be with you all today. Typically, the Farm Bill includes provisions to help farmers and families. And one of the key programs that helps families put food on the table and helps farmers feed local families, you all know this, is the SNAP program. However, the SNAP program is not in this year's Farm Bill. As I'm sure many of you know, SNAP funding was slashed by $187 billion in the One Big Beautiful Bill that President Trump signed into law. In addition to cutting those SNAP dollars that directly feed so many families, the One Big Beautiful Bill also cut nearly $1 trillion from our healthcare system. And the vast majority of those cuts do come from Medicaid. And I don't bring this up to be bipartisan, as my intro indicated. I work on a lot of bipartisan measures. I'm bringing this up because we need to be clear-eyed about the impact of these federal cuts on our state and local funds. And the cost shift of SNAP and Medicaid dollars to states will result in cuts to other vital programs in our communities and counties to bridge that funding gap. And as county officials, you know better than anyone. You are on the front lines of providing those services to our communities. And since Medicaid is the single largest payer of mental health services in our country, the cuts to the program will be significant and will reverberate across the nation. In the wake of these cuts, it's imperative, though, that we explore policy solutions that will not only mitigate the harm of this funding loss in the short term, but also increase local capacity over the long term. And I know you're all in this for the long game. As one of the co-chairs of the Bipartisan Congressional Mental Health Caucus, I'm committed to advancing bipartisan solutions that improve access to mental health care and improve your ability to provide services to your communities. One of my biggest priorities, and I know I share this with those in the room, is filling the gaps in the mental and behavioral health care continuum. Right now, it is too difficult to access providers, I was just talking backstage with some folks about this, and get mental health care in a facility that is the right size and also the appropriate acuity level to meet patients' needs. Because of this, too many people are having to access mental health care, as you all know, in the emergency room or in our jails. This is ineffective and it's way too expensive. In my home state of Oregon, we have nearly a 4,000 bed shortage across inpatient and residential treatment beds, and Oregonians are waiting up to 6 months for a bed when they need care. This is not acceptable to any of us, and I know that. Sadly, I know that Oregon is not unique in the shortage of beds and long wait times. I'm sure you're all seeing it in your states as well. To address this serious problem, I introduced a bill. It's called the Building Capacity for Care Act. This legislation would help address the bed shortage by providing grant loans and loan guarantees to localities to build up their facilities across the care continuum. The federal government can help our communities with capital construction and get facilities online so people can access the appropriate level of care when and where they actually need it. On top of the need to address the expensive reality of bringing beds online, we also need to address our ability to fund these beds. It's why I'm also a proud supporter of the, as was mentioned, the Michelle Alyssa Go Act, a bill that would raise the Institute for Mental Disease, or IMD threshold, from 16 beds to 36 beds. These are the types of common sense solutions that I feel like government can and should step in and help with right now. And I've been telling folks, for folks who don't know, the Bipartisan Mental Health Caucus, I'm one of the co-chairs. I have two other co-chairs who are Republicans and one other who's a Democrat. We should be able to get this done. This is a nonpartisan issue and would help on the ground deliver services for all of you right now. So if there is one message back as you're visiting with folks on the Hill, ask them, can we get this done this year? It would help so much. By raising the number by which facilities can receive Medicaid funding by 20 beds, we can leverage economies of scale while also ensuring patients at these facilities have the highest quality of care and safety. Another crucial aspect of the mental and behavioral health care continuum is early intervention and access to care. If you're uninsured or underinsured, as too many people in this country are right now, how can we expect you to get help when you need it and manage your care? So many people forego that preventive service. For this reason, I've introduced the Hope and Mental Wellbeing Act. This is legislation that would provide 3 no-cost share mental and behavioral health visits to patients who receive Medicare and Medicaid. Without the fear or doubt that co-pays and deductibles cause in people trying to seek care, we can encourage more people to get care when they are struggling and when they identify it and when they are ready. And importantly, schedule that follow-up appointment that is so crucial to care coordination and that continuity. Finally, we need more qualified clinicians to staff the beds that we want to build. We need to provide the treatment, prevention, and recovery services our communities need. And right now, over half the country, 170 million people live in what we call a mental health professional shortage area. Without change, our country is on track to have a severe shortage of providers who will be overscheduled, overburdened, and likely underpaid. It's going to be very hard to attract people to this career. That's why I've introduced 2 bills. The first one, the STAR Plus Scholarship Act and the Mental Health Professionals Workforce Shortage Loan Repayment Act would create a dedicated pool of funds for students who pursue degrees in mental, behavioral, and substance use disorder treatment. These scholarship and loan programs would also give preference to students who commit to practicing in rural and underserved areas. And I think for those, yes, I think that does require some applause. Our rural areas, serving on the Ag Committee is so important to me, and I'm glad GT talked about the upcoming Farm Bill reauthorization. But we know that our rural areas, farmers, fishermen, forestry workers, suffer rates of suicidal ideation at a larger percent than their non-farming counterparts. This is a serious issue that we need to address for rural communities across the country. But clearly, I think all areas are seeing problems right now. Over the next few days, as you go to the Hill to speak with members of Congress and staff, please remember that you are the experts on these issues. As county officials, you know the ins and outs of these programs and your communities, and you are on the front lines of providing mental and behavioral health care. You know what's working, you know what's not working, you know where the gaps are. And I was just saying to folks backstage, bring me the non-sexy, ugly, technical things that you need done, and I will work with my bipartisan counterparts in the Mental Health Caucus to get it done this year. I'd love to see something pass in this space. And as members, we need to hear your stories. We need to hear your challenges and what you're facing. We need to understand what's happening in your communities. Just in my office, we have worked with county officials from Oregon to Virginia to learn what is working, what's not in the mental and behavioral health care space. In fact, we utilize technical expertise from the Yamhill County Health and Human Services Director in my district to improve my bill, the Building Capacity for Care Act. Director Manfrin pointed out that our draft language did not allow localities to purchase buildings that could be renovated for mental health services, which, as you all know, could actually be cheaper than constructing new. Because of Director Manfrin's experience and knowledge of what could work in her county's budget, we were able to add 3 words, purchasing existing property, as an eligible activity for a grant or loan, and truly improve the bill text and make it more affordable for those trying to expand care. So I just want to say again, you are the experts. Please bring your stories and experiences to all of us on the Hill and push for a bipartisan piece of mental health legislation. Thank you so much for being here. Please let me, my staff know what kind of feedback you get. We will follow up. Your knowledge can shape policy, influence the priorities we pursue, and even improve bill text. So thank you.